Hi, welcome to another one of our Dr. Foot videos. In this video, I'm going to be talking about the common lower limb tennis related injuries that I see in clinic. Now, tennis players can get a variety of different conditions that affect the lower limb. As you can see by the video that is playing, which is my favorite tennis player, and she's awesome, the amount of forces that go through the lower limb during a forehand and a backhand is immense. What this video doesn't show you is the rotational forces that go through the knee and the pelvis when you have to suddenly change direction when you're playing a shot. What it also doesn't show you is the kind of forces that go through the lower limb when you're sprinting towards the ball, which is at the net. So a couple of the most common injuries I see. One is a tennis leg, which is a short term for meaning that you have damaged your calf muscle. So the muscle that often gets damaged is the medial head of the gastrocnemius, which is the most common place where you can actually get a calf strain. So you will be sprinting towards the ball and you'll suddenly feel a sharp pain in the back of your calf muscle. What we do for this is we have to give an ultrasound scan to see if it is that structure that is damaged, and then depending on the amount of damage, we will manage this differently. A couple of the other conditions that can occur in tennis players that we see a lot in clinic, one of them is damage to the Achilles tendon, because you are constantly on the balls of your feet and you're sprinting forward, or when you're taking a shot, you are putting a lot of forces through this tendon. The Achilles tendon goes down at the back of your leg and connects into your heel bone, which is the calcaneus. Now you can get pain at the insertion of the Achilles tendon or the mid portion of the Achilles tendon. Both are treated completely differently in terms of rehab and in terms of other options that we can provide, such as injection options. One of the other conditions that can occur with tennis players is plantar fasciitis or plantar fasciosis. The plantar fascia is a broad, thick tissue that runs under the sole of the feet, and it helps to maintain the arch. You can get plantar fasciitis, which means you'll get intense pain first thing in the morning and after periods of rest, and it can really affect your daily activities. And we treat this in many different ways, but diagnosis is key when it comes to plantar fasciitis because there are so many other causes of pain in this region. One of the other things that occurs with tennis players is they get stress fractures, commonly in the second metatarsal, but they can get them in other metatarsals also. Also, oftentimes patients get ankle sprains, so they turn their ankle out too much and they will get a swollen ankle. We can manage this in the short term. However, if you're getting constant chronic ankle sprains, which meaning you're getting them every year and not just once a year, you're getting them a few times a year, then we need to see you in clinic. We need to do some exercises to try and build up strength around this ankle region. We may need to give you some insoles and orthotics to aid in that movement. That's very important. One of the things that also happens with tennis players is you can impinge a nerve that comes up in between these two metatarsals, and that nerve gets swollen. So you'll get pins and needles and burning sensation in your feet. Now we can manage this really well with insoles and an injection just to calm down the inflammation and the symptoms. Works really well. What also happens to tennis players is patellar tendonitis. So those sudden changes of movement when you're trying to go for a shot, or when you're serving and you haven't warmed up correctly, you can get tendonitis of the patellar tendon. There are so many other knee injuries that can occur, but this is probably one of the most common injuries that I see, and we would manage this in different ways also. I probably haven't touched upon all the lower limb injuries that can occur with tennis players. One of the other ones is a hamstring strain that can happen a lot. If you have any problems related to your lower limb, come and see myself or another podiatrist who specializes in MSK biomechanics, and we can have a look at you and we can see if we can give you a management plan. Hope you found this video helpful, and thank you for listening. Bye.